Hi, I'm Dr. Orin Michaeli. I'm a peripheral nerve and microsurgeon, and today we're going to talk about painful scars. What are painful scars and what aren't they? So I kind of say it's like a little bit of a pet peeve of mine when other surgeons will send a patient, let's say to pain management, for painful scars. Well, why is that? Well, it's because scars in and of themselves don't feel pain. You need nerves in order to feel pain. If you look at a map of the body and where they have sensory nerves, there are sensory nerves that are going anywhere that you're feeling it. Now, closer to the spine, the nerves are larger, and as you get farther away, they get smaller and smaller. So they are fairly small nerves, but if you take an S100 stain and you go to a pathologist, you will see that there are nerves that innervate the skin. Same way if you look at large nerves when you're doing, let's say a dissection, if you pull a large sensory nerve, you could see the skin actually tenting sometimes. So you could see where that, like the biggest mass of that nerve is really entering, and when you pull on the nerve, you'll see the skin pull in. Likewise, if it's a motor nerve, you could actually see muscle pulling when you pull on the nerve. When someone does surgery, you're invariably going to cut nerves. It's not about a good surgeon or bad surgeon in 99.99% of the cases. So these small cutaneous nerves, they're going to do whatever they're going to do. Sometimes they're going to cause no pain. They're put back together, they're going to be fine. Other times, they may form a neuroma and cause a pain generator. If you're having a painful scar and 6 months goes by and it's still painful, I don't think narcotics or medications are the right way to go. I think that you need to address the issue. It's tedious work because these are fairly small nerves. I have one gentleman who was involved in an explosion. He had scars all over the leg, and in the pre-op area, I tapped on a bunch of different scars in the leg. I put an X on each one of them that generated an electric shock or severe pain, and this was 9 months after his injury. I went in with the microscope. I resected the massive scar that it was caught in and the neuroma associated. I grafted those nerves. The pain went away, and he's doing fantastic. That is my take on painful scars. These are usually able to be resolved with a high success rate. Painful scars are not a thing. These are neuromas of cutaneous nerves, and they need to be treated like a neuroma. And if you fix the nerves, you free up the nerve from the scar, or you reconstruct it, the pain goes away. The recovery for these are fairly simple usually. Again, these are scars and they're cutaneous nerves, so it's skin deep. We do, however, do this in the operating room because we have good lights and we have a microscope and we have microsurgery equipment. You come in, usually it takes an hour to futz around in an incision that could sometimes be this big. We find the nerve, we fix the nerve, you go home, you go back to life as normal pretty much the next day. Usually you're showering within 2 days. There is zero activity restriction. Life goes back to normal right away. Patients, if it's very tender, will often feel better immediately. However, they will feel that burn of the surgery incision and the itching that's usually associated with a surgical incision for a couple of weeks, but they usually feel significantly better afterwards, and they're usually fairly happy.